I'm Dr. Phani Madhuri. I'm a senior consultant obstetrics, gynecology, fertility medicine and laparoscopic surgery at Kiran Infertility Centre, Koramangala, Apollo Cradle Hospital, Gynaecologist Bengaluru. Now let's understand what is a normal menstrual flow, right? So the duration of the cycle should last somewhere between 21 to 35 days. Anything deviant from this is called abnormal. The number of days of bleeding should usually be around 3 to 6 days. Right? And if the duration is more than 6 days, or if you are having heavy menstrual bleeding, like you have to change your pads very often, or you're passing large amount of clots, you're having severe weakness and giddiness during your menstruation, you're unable to do your day-to-day routine, all this is considered as heavy menstrual flow, right? And also the pattern of bleeding is very important. Normally the bleeding is heavy on the second and third day. The first day could be a little lighter, and then the fourth, fifth, sixth days will be very light, and then it stops. But if you are having spotting before your periods, you are having very heavy menstrual bleeding, and you're continuing to spot even after your flow stops, then it is considered abnormal. So, and if the volume is more than usually 50 ml is what we consider as a very heavy menstrual bleeding. So if you have any of these things, you should definitely worry. And if this is happening above age 30, yes, you might have to think of hormonal changes that are happening, nutritional problems, thyroid issues, prolactin issues, or probably any organic pathologies in the uterus like fibroid polyps, or there can be fibroids in the uterus, there can be endometrial polyps, or there can be problems with low ovarian reserve, that is called low AMH also. So these conditions can contribute to heavy menstrual bleeding after the age of 30. Well, heavy menstrual bleeding can just be a random symptom in a random cycle due to some kind of, changes in your daily routine pattern, like probably sleep disturbances, or probably stress at office, or you have had some antibiotics for some other reason, you've been ill for other conditions. It can be normal. But if heavy menstrual bleeding is happening continuously month on month, you're deteriorating every month, or the symptoms are progressively increasing every month, please think of other underlying conditions like your fibroids, your polyps, your polycystic ovarian disease, or your thyroid problems. Yes, they may be silently coexisting in your body, and all these conditions can result in abnormal heavy bleeding due to some other problem causing in the uterine lining because of the hormonal dysfunctions and because of the structural problems that these conditions come associated with. For example, fibroids, if they're very big, they increase the surface area of the endometrium, so the amount of bleeding could be excessive, and they interfere with the normal uterine contractions during your menstrual cycle that stops the bleeding, so you can have heavy bleeding. The polyps again are causing continuous irritation and increasing the surface area of the endometrium, and there can be continuous heavy bleeding or maybe spotting in between the periods. Coming to thyroid problems, yes, thyroid is an important endocrine function that controls your ovarian hormones as well. It controls your cycle, it controls your weight, it controls your sleep. So any changes in the thyroid can also affect your menstrual cycle. So please have a check with your doctor regarding your thyroid status. Now coming to polycystic ovaries, there is something called a high level of estrogen that happens in polycystic ovaries. Because of the continuous estrogen hormone production, the lining of the uterus can become very thick. This is called endometrial hyperplasia, and this can be one of the reasons for continuous heavy menstrual bleeding that happens in patients with polycystic ovarian disease. So like I said, if there is a heavy menstrual flow during one random cycle in a year, or just a random event once and it stops, I don't think so you have to worry much. But if these symptoms are repeatedly happening over a period of time, or if there is worsening of these symptoms over the time, and if the patient is unable to do their routine day-to-day activity during the menstrual cycle, or it is interfering with your normal routine work, you are unable to do your office work and school work during your menstruation, you're constantly feeling weak, fatigued, you're having giddiness, you're having severe weakness, then you definitely have to see the doctor. So what are the common tests that we consider to understand why the patient is having heavy menstrual flow? So generally we try to look at the basic blood work, that is we check her hemoglobin levels to see if there is any signs of anemia or not. We also check her platelets, we also check her coagulation profile to see if there is any underlying coagulation abnormalities, which is why she is bleeding heavily. We also check for her thyroid status. Like I said, thyroid function is very important to control your menstrual cycle. We check for ovarian reserve tests in case we find anything abnormal on the scan. We also check for polycystic ovarian disease diagnosis if we see again something abnormal in your ultrasound picture. We also check if she is having any problems with her sugar or insulin resistance. We also check for her prolactin levels, because if there is abnormalities in prolactin also she can have irregular menstrual cycles. These are the basic parameters, and of course we also would like to see if she is having severe vitamin D or B12 or any other deficiencies. And if the patient is obese, having obvious features of polycystic ovarian disease, we'd like to see if she has any problems with her lipid profile, her liver function and renal function also, before we started on any other hormonal treatments. And the other important tool for us is a basic pelvic ultrasound examination. Now this test may look very simple, but it has got extreme amount of information regarding the anatomy of your uterus, your ovaries and your hormonal conditions like polycystic ovarian disease. So a simple ultrasound can pick up conditions like fibroid uterus, polyps. It can also tell you whether you have any endometriosis, what is your basic ovarian reserve there, and also if there is any polycystic ovarian disease or not. Let's talk about the natural methods to control heavy menstrual flow. Yes, lot of women are looking for options as much as they can do at home. I think correction of lifestyle is the single most important factor that all of us have to focus. Because of our lifestyle alone, we are prone to sedentary lifestyle, that is, our mobility has drastically reduced. We are having a lot of calories actually what we require, so there is a lot of overeating that is happening without our knowledge also. And we are into a lot of processed food because of the sheer availability and lack of time of preparing whole foods at home. So I think taking care of these simple things like trying to eat home meals, trying to cook your own food, understanding what exactly goes into your meal plate is very important. Portion control is very important, and try to incorporate all kind of fruits and vegetables in your daily diet. Also nuts, sprouts and whole grains are very important for your overall health. And using good quality cold pressed oils or ghee, these are very good sources of natural fats. And having regular exercise is extremely important to maintain your menstrual bleed in a normal fashion. So exercise at least for 45 minutes every day. This is going to give you good energy throughout the day and also keep your menstrual cycle in regulation. And sleep. Coming to sleep, I don't have to stress this enough. Sleep is extremely important to regulate all your internal hormones, including your ovarian hormones. So having good quality sleep at least for 8 hours in the night. Try to sleep on time, like about 10 o'clock, and try to get up at 6 o'clock. So you have a good quality sleep, then the whole next day will be automatically going ahead in a proper way. You will not have your hunger pranks, you will not get into bad food, you will have the energy to exercise, and you will go to bed again at the normal time the next day. So everything will fall into place provided you tackle your lifestyle. The second thing is probably you can make slight dietary changes like have turmeric tea or ginger tea. These are anti-inflammatory in nature. You can try to have some soothing hot packs to help your menstrual cramps come down. You can also opt for some natural herbs if you are interested in them. And these are your natural remedies. Coming to the medical treatments for heavy menstrual flow, we have a plethora of options, but we always start with a simple treatment called tranexamic acid, which is a simple effective method to control your menstrual bleeding. And if you're not responding to tranexamic acid, then we go ahead and evaluate you hormonally to understand why the bleeding is happening, and probably add on hormonal treatments like progesterone or contraceptive pills in a different format to control the bleeding. And if you're not responding to any of these formats, then we may even go ahead with some GnRH injections or a Mirena coil, that is a progesterone IUD coil, to control the bleeding. And if none of these methods are actually helping and they've been tried and tested for a prolonged period of time with no actual benefit, then we think of surgical options. Like if we see any abnormalities like fibroids or polyps, then we may think of going ahead with a surgical removal of these conditions. If there is severe PCOD, then of course you have a surgical correction option called laparoscopic ovarian drilling. And if you have endometriosis, then also you can go ahead with a surgical removal of the cysts. So all these things collectively put together will help you recover very fast, and you can come out of the problem of heavy menstrual bleeding.